President.
Senator from Louisiana.
Mr. President, I ask unanimous consent that Genevieve Gorman, a legislative aide in the office of Senator Cassidy, be granted privileges of the floor for the remainder of the 114th Congress.
Without objection.
Mr. President, I come as a senator, but actually I come wearing two different hats right now, two more hats aside from being a senator. One, I'm a teacher. I still teach with LSU Medical School in half of the last 30 years. So I decided to do a presentation on something which, wearing my next hat, as my life as a physician, I've done much work in public health. And have learned, by the way, that if you head off illness early, you save a lot of money. You save a lot of money after that. I call it the balloon theory. If you put a balloon up to helium and you squeeze the nozzle, it inflates so quickly. But if you pull it off the nozzle, it remains deflated. Right now, we have something at risk with Zika that'll be like that helium balloon, inflating rapidly, unless we do that initial thing which pulls the balloon off the helium so that it works. Now, I'm a teacher, so we decided to do something differently. Next, please. If anybody in the audience so chooses, they can put their phone up and their QR code reader up to the television or the computer monitor, and they can scan this barcode, and you will see the slides that we are about to go over. So if you're watching at home and you wish to follow, then you can download these slides, and if you think them important, then you can forward these slides to another person. Again, that's my effort as a teacher to try and speak about the spread of Zika. Why don't we go to the next? Okay. This is Jose Wesley, born to a Brazilian mother who contracted Zika probably in her first 3 months of pregnancy. And when Zika went through the mama's blood when Jose was in her womb, into the amniotic fluid or through the placenta, it entered Jose's body and went to his brain. Now that virus stayed inside his brain, and the response of the body to the virus within the brain terribly affected the brain. And Jose has been born with microcephaly. Now you can't really see from this angle what microcephaly is, but what microcephaly means is small brain. Next, please. And here's a profile of a child with microcephaly. And you can see, unlike the big head that babies normally have, this is a very small head. And this is associated with severe neurologic deficits and early death. This is a tragedy and potentially a preventable strategy. Next, please. Now, again, the teacher in me wants to talk a little bit about Zika, but the spread of Zika historically gives us insights as to what we must fear now. Zika was first discovered back in 1951 in Africa, Uganda. And then at some point in the 3 decades that followed, it spread quickly to Asia, and then from Asia to the Yap Island in 2007, which is in the Pacific. In 2013 and 14, it went to more Pacific islands, and in 15 and 16, it entered the Americas. At some point, it began to spread rapidly. And this is important because it is now in the Americas, threatening Americans. Next slide, please. And these are states which have cases of Zika. Here's the U.S. Virgin Islands, and here's Puerto Rico. They have the most, but almost every state is affected. Most folks have contracted it elsewhere and brought it back to their state, but there are some folks who received it sexually, so their partner contracted it perhaps in Brazil, came back to Texas or Florida, or Louisiana, where I am from, and they contracted it sexually. But nonetheless, the virus is in the United States. And it's particularly a problem in Puerto Rico in the U.S. Virgin Islands. Now, these are American citizens. These Puerto Ricans, if they wish, can board a plane and travel any place they wish in the continental United States. And that is their right as an American. Similarly, these folks who are infected in these states can travel any place they wish. Why is that important? Well, theoretically, next please. It is important because these are the areas where the mosquitoes that carry the Zika virus live in the United States. So theoretically, wherever these mosquitoes are, and Hawaii should be on here someplace, wherever these mosquitoes are, the virus can enter, and the virus can be transmitted by the mosquitoes to many other Americans. By the way, though, it isn't just that you have to live where the mosquitoes are. The first person to die from Zika in the continental U.S. just died in Utah. She had contracted it elsewhere, but then died in Utah. So the risk to our country is at least at this. I will be perfectly honest. It is particularly a risk for those upon the Gulf Coast, because we have the sort of semi-subtropical climate in which Zika flourishes, and that is why I am particularly concerned. But again, wearing my other hat as a public health doctor, I know we have this moment in time. And either we pull that balloon off so it doesn't inflate with Zika, damaging our country, creating more Jose's who are here in the United States, or not. Next slide, please. Now, some of you may have seen the barcode that I held up initially, and you may have downloaded that. We will hold that barcode up again if you wish to download these slides, but all these are on the PowerPoint presentation that you may download should you wish. Now, public health emergencies are inevitable. So let's talk about the response to this one. There's been $600 million that was left over from the Ebola fund that has been released to CDC and other agencies to mount a response against Zika. $600 million was left over. Only about a fifth of it has been spent, so there's still substantial dollars yet available. But the CDC and other federal agencies say that they need more. Republicans have supported $1.2 billion in additional funding to fight Zika. Now, my colleagues on the Democratic side we have a difference over this. They are opposing this $1.2 billion to fight Zika because they say that the Republican bill discriminates against Planned Parenthood. Now, Planned Parenthood is not mentioned in the bill, and the way it discriminates, and sometimes I've been in Washington in the Senate at least for 2 years, and sometimes you got to kind of figure out why people are taking offense at something. Even though Planned Parenthood is not mentioned, the reason that they object is because we specify that the money needs to go to a public agency, one that sees Medicaid patients, the state, territory, federal program to take care of the uninsured. Now, Planned Parenthood is not a Medicaid provider. So it isn't that they're not mentioned, it is that they are a private entity who in Puerto Rico does not accept Medicaid. So we could carve in and say if you're a private entity, you can also receive this federal dollars to provide family planning. It just so happens in Puerto Rico, Planned Parenthood does not. So Republicans are trying to release $1.2 billion to pull the balloon off the helium so it doesn't inflate with all kinds of cases. And one more case of an Jose would be one case too many. But we're caught up in the snafu about Planned Parenthood. It's the craziest thing in the world. But unfortunately, that's sometimes how Washington, D.C. works. As a public health physician, I find that incredibly offensive. As a doctor who understands the critical nature of this, I'm asking folks on the other side of the aisle to accept that this bill may not be exactly what they want. It's not exactly what I want, but it is something which would give additional resources to the Centers for Disease Control and others to begin to fight the Zika virus before it comes more extensively to our nation's shores. Now, we can anticipate that public health emergencies in the future are inevitable. For example, we've had Ebola recently, we've had West Nile virus, and we've already spoken about Zika. So aside from hoping that my Democratic colleagues will agree to release the $1.2 billion to fight Zika now, there's also something else I'm proposing, but again, I don't want to sound overly partisan because I'm doing this particular bill with my fellow Democrats, with Democrats. Let's go to the public health emergency. Yes. With Senator Brian Schatz from Hawaii, we're putting forward the Public Health Emergency Response and Accountability Act. And what we do, again, I'm from Louisiana, and we've had hurricanes. Hurricane Katrina is the one which is most famous. If there is a hurricane or another natural disaster that hits an American state, then FEMA has a budget which is automatically triggered. It doesn't have to go through this appropriations process. We don't tie it down in discussions of extraneous matters. It is something which immediately comes to bear to bring relief to those affected by natural disaster. The other thing that is done is that normal federal contracting processes are waived. So instead of having 10 different signatures, which literally might be the case, for someone to travel from Washington, D.C. to, say, Louisiana or Kansas or to Florida, it is waived, and that person, that emergency response coordinator, may immediately go. Now, there is oversight, so this is not carte blanche, but it is a more effective way to bring federal resources in partnership with local resources to bring relief to those affected. So we also bring that flexibility in the use of funds while retaining accountability. Again, we call this the Public Health Emergency Response and Accountability Act, and we anticipate entering this in very soon. And Senator Schatz has been wonderful to work with in terms of this aspect of what we're doing. So 2 issues. The $1.2 billion that we should release now. That would immediately go, and it's not a perfect bill, but we've got to prevent more cases of these children who are tragically born with microcephaly, as well as more deaths, such as the woman who recently died in Utah. And then number 2, we need to have the Response and Accountability Act, which gets rid of this kind of process we just struggle through in order to release those funds to bring the relief that we need. Next slide, please. So let me just summarize by saying this. This is a baby with microcephaly. We've had, I think, 3 children born in the United States already, not conceived here, but born here, who've had microcephaly. This child's life is limited, will most likely die at an early age, with severe neurologic deficit. If you just want to look at it in a dollars and cents approach, this child will be a ward of the state for the entirety of her life and will cost the federal taxpayer millions of dollars. Now, we've had these babies born already in Puerto Rico, New Jersey, and Hawaii. There's 2 pregnant women in Illinois who tested positive for Zika, and we've had a death in Utah and Puerto Rico, not from children, but from adults. The question is, will the Senate work to stop this? Go ahead. And again, if you are watching and you wish, you can scan this barcode, you can download this presentation. And then let me finish by saying this. I just said the Senate should work to stop the spread of Zika. You can do something. We are a representative democracy, and we respond to you, the people, and if we don't, by golly, you should vote us out. So I am asking you, if you're watching at home and you think that there needs to be a response quickly and efficiently and effectively to combat the spread of Zika, you can either barcode this or not, but whatever you do, call your senator, ask her or him to support efforts to stop the spread of Zika, to release the $1.2 billion, and to also support the bill that Senator Schatz and I are putting forward, the Public Health Emergency Response and Accountability Fund. Ultimately, we answer to you, the people. That's a good thing. I ask you to perhaps use this tool to help us, to encourage us to answer to you as we should. Mr.